Welcome back, YouTubers, to my channel of an everyday life of an Aspie. If you're following me right now and you're new to my channel, I welcome you all. I'm AspieAnswersAll, or as I'm not clinically known for most of you as Aspie. I'm all about talking about mental health and awareness versus sharing my life stories with Aspergers Syndrome and the like, along with tips and advice along the way for your general health versus your personal health struggles of your mental health or what have you, along with also basically some beauty from ashes topics of your everyday personal struggles, what you go through, of everyday topics that may need to be addressed that comes close to my heart to share with you all. It has been brought to my attention, even though, like I said, that the autism and the mental health awareness series will be kind of real big and broad of these everyday topics that I'll bring out, because as we know, it needs to be clearly addressed, like many other topics that's close to my heart right now. So this one's all about schizophrenia. Hopefully you're liking this. This is the last part, hopefully, of this, and this one's called Dating a Schizophrenia, along with tips and advice. If you are enjoying these, smash the like button, and also if you feel that these ain't for you, pass it on to someone you feel it is right for them. As a disclaimer, as always, also, I'm no medical doctor. I'm just a normal everyday Joe vlogs, just, going on my merry way, just trying to do the best I can with my life. And if you see any warning signs and symptoms in regards to any of these mental health issues or just general health topics, do seek professional advice or medical attention for yourself or your loved one. So, as I said, this is the last one, and just to bear with me also as a heads up note too, is that some of the statistics versus the facts I've been getting is from American versus UK sites that I have been researching, which I'll link some of them to the description below, which I humbly apologise in advance because, as you know, I'm a New Zealand Kiwi. I've not been trying to, find as much info as I can. So, as we know, basically, though there has been only an estimate of 1% of the American population that does suffer from schizophrenia. However, it can be a terrifying experience, both for those suffering from it as well as their friends and families. If you're dating a schizophrenic person or suspect your date has the condition, here are some things to keep in mind. Be honest with yourself is number one. If you're still not into a relationship with a schizophrenic person, consider long and hard if you want to. Schizophrenia is a real complex mental illness that's for life, like many other mental illnesses, and despite the newer options in treatment and therapy, a person affected by it will never be able to offer you the kind of emotional and psychological support that a completely healthy partner can for you. If you begin dating a patient of schizophrenia, there are bound to be times when you feel you do not know the person you are with. You may be required to give more and expect less from their relationship, which over time can prove to be exhausting and unsatisfactory. So if you're still not seeing this person seriously, consider whether you will be able to get emotionally involved with someone who requires long-term treatment and support in the long run. Number 2, be informed. At the same time, however, as what I mentioned just now, there are many people with schizophrenia who are leading rewarding and meaningful lives in their community. With the regular treatment and medications that are given, it is possible to keep the symptoms in check, and if you find that someone with schizophrenia enriches your life with love and meaning, there is no reason why you should hesitate dating him or her. In such a situation, first thing you need to do is gather as much information about the illness as you can. Do your research, do your homework, so to speak. Schizophrenia, as I said, is a chronic, severe and disabling brain disorder with severe symptoms like hallucinations, paranoia, delusions, and altered perceptions of reality. But not all people with schizophrenia will likely to have these symptoms. It will vary from person to person. However, scientists believe several genes are associated with an increased risk of schizophrenia, but that no gene causes the disease itself. Other medical experts are of the opinion that an imbalance in the complex, interrelated chemical reactions of the brain involving the neurotransmitters. Treatment for the conditions ranges from antipsychotic medication to stabilize most severe symptoms to psychosocial treatments, which help patients deal with the everyday challenges of the illness, such as difficulty with communication, self-care, work, informing and keeping relationships. Being informed about various aspects of schizophrenia will not only help you to understand the difficulties being faced by your partner, but also enable you to be cued into medications, their side effects, and drug interactions, all of which can have an impact on your own personal relationship. Number 3, be prepared. Even though there are different types of schizophrenia out there, almost all lead to very difficult relationships. If you're dating someone who you believe may have the condition, it's important to learn your role, as the partner can adversely affect the symptoms of the schizophrenia. Your partner may, for instance, be experiencing hallucinations and abnormal mental processing. They may be hearing voices other people don't hear. They may believe other people are reading their minds, controlling their thoughts, or plotting to harm them. Sometimes people with schizophrenia seem perfectly fine until they talk about what they're really thinking and could be misinterpreted, and then cause the schizophrenic partner to begin making accusations that are unfounded. Thus, your date may accuse you of cheating on them or having an affair behind their back, which, though completely unfounded, may seem only too real to them. When dating a person with delusional schizophrenia, however, therefore, it's important to recognize when the delusion starts or may be sneaking up on your relationship and find a way to diffuse. You may need to find a way to diffuse them as much as possible. One of the best ways of doing this, however, is to use an avoidance method and then try to redirect your attention to another topic. Under such circumstances, however, you may need to keep in mind that you can't typically win an argument with a delusional schizophrenic, so attempting to prove your innocence isn't likely to be unsuccessful but completely ineffective. Above all, remember that even if you have managed to avoid this argument and the delusion has passed, there are sure to be more in the future, and you need to take things as they come. Challenges in the long run is number 4 or 5 of these tips and advice for you. Finally, consider that this condition is typically catatonic, I should say, and over time your partner's mental health will most likely to deteriorate. While you may be only dating now, if you're keen on a relationship, the person with schizophrenia must be willing to treat their condition. Besides this, you as the partner need to assist them on the treatment, and only then you can hope for a healthy and safe relationship. Many people with schizophrenia have difficulties in holding a job or caring for themselves, as sooner or later your partner may have to rely on you or others for help. Furthermore, a schizophrenic is usually unable to work or may have trouble keeping a job, putting the majority of the financial burden on their partner. Schizophrenics also have trouble reading social cues, which may lead to, again, arguments and misunderstandings. Then again, intimacy is affected both by the disease and the drugs that are used to treat it. Schizophrenics may experience a decreased interest in sex, and certain medications used to treat schizophrenia can also cause a decrease in libido. Although this may create a high level of stress which can push the partner of the schizophrenic person into depression, not only will you have to keep giving in the long run, you can't even expect your emotional needs to be met in the relationship. If all this seems too much for you to bear, then perhaps you shouldn't be taking this any further. On the other hand, if you believe you can take responsibility for the mental health of your partner and that of your relationship too, you would need to create your own support network system and put them in place. To close this, forming close bonds with the family and friends of your schizophrenic partner so that you have a backup of well-wishers and helpers to take care of you as well. You need to remember also that is important for your mental health to be in check and to take care of it. If necessary, seeking counselling may help you in the long run as well as your partner. It is common for partners of those suffering from serious mental health disorders to become codependent and sink into depression or an unhealthy relationship. Opt for couples counselling or joint therapy in order to better communicate with your partner as well as to meet the challenges in your relationship together. So this one ends quickly, basically, on the dating and schizophrenic tips and advice. Give me a like for thumbs up for support, comment below. Feel free to open the floor for discussion if need be for any other advice you might want to give out or share your stories with schizophrenia so we can, better understanding of each other. Feel free to follow me on my social media sites that are listed below. Feel free to follow me on here by subscribing to my channel so you can get up to date with my journey and so you can follow me with my journey of what I'm doing, as well as turning that notification bell on. So share these videos around to family and friends or whoever to self-educate yourself or whoever. And all further ado, guys, thanks for support, thanks for watching, do what you love what you do. Until next time, Aspie signing out, and I'll see you again soon.